Assalamu alaikum and welcome to a brand new episode of Mental Health Matters with me, your host Mariam Halli, and joining me on this weekly show is our very own mental health professional Anisa Diab. Welcome to the show, Sister Anisa.
Thank you so much for having me.
Thank you for having us. So Anisa, today we want to talk about sadness, grief and depression and how to cope. So just to start us off, can you tell us briefly what are the main differences between sadness, grief and depression?
So sadness, grief, and depression are terms that are often used interchangeably, but there are some really distinct differences that we want to keep in mind. And I believe it's really important to talk about these differences because we know that language matters, especially when we hear folks saying, I'm so depressed, when really what they mean is I'm feeling sad, which we all have bad days, we all experience sadness, but not all of us are struggling with clinical depression. So first of all, sadness and grief are normal human emotions, they're normal responses. Sadness tends to happen more of when there's a significant adjustment going on. Maybe it's a challenge like going away for college for the first time and having to meet new friends, being away from family, but not having enough support yet in that experience. And when we look at grief, it's a bit different. We're looking at a direct response to loss. Now, when it comes to grief, a lot of times people associate grief with death or somebody having passed away, but you can also experience grief when you lose your job or when a relationship comes to an end. Not only this, but you can actually grieve the idea of something as well. Maybe, you suddenly have been diagnosed with cancer and you're grieving the loss of the health that you once had, the loss of the independence you once had. Maybe you are grieving a near-death experience. You just, almost lost your life in a car accident, and now you're mourning and you're going through this darkness of, why am I still alive? Why am I still here? Trying to make meaning of that experience, right? And, sometimes we grieve for long periods of time. Maybe, we're slowly watching somebody pass away. We know that this person has 3 months to live, and that's why many times people, by the end of that grief process, they think to themselves, well, I just want this person to be rested now. I don't want them to be suffering anymore, because really you've been preparing for this for all these weeks and months and sometimes years. But, with grief, with sadness, there can be intensity definitely in terms of not being able to accept what's going on. There might be some disruption in sleep, a loss of appetite. But when it comes to depression, this is different. There's a significant difference. We're talking about a mood disorder, okay? And mood disorders are much more intense. They're much more long-lasting than just typical sadness. And there's so many different types of mood disorders too. A lot of times, we just tend to hear about clinical depression or major depressive disorder. But, and those who have that, typically they'll face sadness, hopelessness for about 2 weeks or more. But there's also others like dysthymia, where where somebody has chronic depression over 2 years at least of depression. So when they have a depressive episode, it's like having a double depression. There's bipolar disorders where somebody exhibits symptoms of mania and has goes from ups and downs in terms of their mood. There's postpartum depression. There's substance abuse mood disorders. So if you're tuning in today, you may have never experienced a depressive episode before. However, depression, mental illness, they don't discriminate, not because you're Muslim, not because you're male, not based on your socioeconomic status. It doesn't discriminate. And we know that sadness and grief can turn into clinical depression over time. So prevention is absolutely critical.
And when someone is going through a difficult time, when they're grieving, people tend to give them advice like, be strong, time is a healer, don't worry, stuff like that, have faith, etc. Would you say that this is like toxic positivity or like unhelpful, perhaps, comments? Or what's the best way to deal with the situation? What are the words of consolation that we can use when people are grieving?
Yeah, I think you know what the beauty of Islam is it's so much focus on akhlaq, right? And our manners and how we interact with people, and our words matter, our language matters. So sometimes we might believe that we're doing somebody a favor by just saying like, "Hey, you need to move on," and that we're trying to point out a flaw in what they're struggling with, or look, you need to get it together. You've been crying for 2 weeks, like get over it. But really, you know, that's not helpful in the moment. You know, and I just remember a personal experience I had had when my grandmother had passed away. I was, you know, in her funeral. And of course, my mom and I, my brother, we were all pretty distraught, of course, on this occasion. And someone had come up to me at that time and, you know, said to me, listen, like, you know, just you can't cry, you can't be upset. Like, you need to be strong for your mom right now. You need to be strong for her. And I remember in that moment feeling so like disinvalidated, that yes, like of course we need to be strong for each other in different ways, but at the same time there are going to be moments in life where we don't feel strong, and it's okay to not always feel strong. Sometimes being strong means that you cry and you let those tears fall. And I think that's just an indication that we're human. It's an indication that we had a really deep connection with someone and that it's hard to say goodbye. So I think instead of just like telling somebody to be strong or get over it, the best thing to do is say, how can I help? You know, can I cook, can I bring over a home cooked meal for tonight or for the week so you don't have to worry about it? Call them, check up with them. Is everything okay? I know it's been, you know, a week or two since your mom passed away. How are you feeling? You know, offer to host maybe a gathering in their name, recite Surah Yasin, have them come over, find a supportive group that can come and just be with them, be present with them in their discomfort. A lot of times people have a hard time, like you mentioned the term toxic positivity, that this idea that we always have to, you know, make everything positive, like wave a magic wand when somebody's feeling upset and try to fix them. It's just not helpful to that person, because people need to be able to lean into whatever emotion they're experiencing at the time. And you know, sometimes people say time heals things, or just, you know, just wait a year from now you'll feel differently, but that's not always the case. Sometimes nothing can fill that void or that gap in that person's life.
Another thing I wanted to ask you is there such a thing as grieving too much? Because I know that when my friends have been through things, there is, you know, there are times where I'm like, oh my God, you know, like, you know, she's been grieving for such a long time. Should I like help her snap out of this? Or is there a time frame for grieving? What's expected?
That's a great question. And I think there it depends on the context in which the person experienced the grief. For instance, if it's a traumatic kind of grief where perhaps, you know, they faced a sudden loss that was completely unexpected, that person may take a little bit more time to cope. Or maybe it's if it's a matter of oppression that has been playing out for a very long period of time, it may take more time to really get through those grieving processes. And you know what's interesting is when we look at the life of the Holy Prophet sallallahu alaihi wasallam and AhlulBayt, we see they grieved openly about what it is they were experiencing. Like when you looked at the Holy Prophet, where he was grieving the loss of his sons, you know, he cried, he showed his sadness, and the Holy Prophet was then comforted by Allah subhanahu wa ta'ala, right, through Fatima al-Zahra alayhi salam, and through sending down the surah of Kawthar. So Allah subhanahu wa ta'ala tried to comfort the Prophet during that time. But we look at stories such as, you know, what happened with Nabi Yusuf alayhi salam and Prophet Yaqub, and look at how long this father cried and grieved the loss of his son, and the intensity with which he did it, to the point that he became blind. So, you know, and then we're looking, Muharram is upon us too, right? And when we're looking at the martyrdom of Imam Hussain and the companions, we would see that anytime Imam Zain al-Abidin alayhi salam was even reminded of food or water. You know, he was brought to tears. He would just choke. Even 20 years later, you know, he would continue to cry over the events of Karbala when food was placed in front of him. Imam Ali alayhi salam, whenever he passed by Karbala, you know, his eyes would fill with tears because he knew what was going to happen to his family in this place. So grief is a very complicated process, and sometimes it can be complicated in the sense that somebody has grief for an extended period of time and you wonder, you know, when are they going to get through it? But it's important to realize that there's different stages, right, that everybody goes through in terms of healing. And you probably heard of the 5 stages of grief model, but there's this idea that you go through different stages. You go through denial, you go through anger, you go through depression, you go through acceptance. And a lot of times people think that these processes are linear, that you have to start with the denial and then go to the anger and then the bargaining and the depression and the acceptance. But this is not the case. Sometimes people don't go through all these 5 stages. They might feel one stage more than another stage. Sometimes people will, you know, you think they've gone through the acceptance process of what's occurred in terms of their grief, but they still, you know, something maybe 6 months later triggers it again. And then they're going through those stages again. So progress is never linear in terms of healing. You know, it's messy. Some days are better than others. And sometimes, you know, there's a lot of anger that can be experienced by folks. And this is something I sometimes see a lot with Muslim clients, where they experience a loss or their du'as don't get answered in terms of their losses. And they wonder, you know, is Allah there for me? Like, when is Allah going to, you know, get me out of this situation? You know, they're trying to make meaning of what has happened and the loss and the intensity of the sadness that they're experiencing. So I would say that you can't really put a time frame on grief. It's a process, that's for sure. Everybody goes through it differently. But I think if somebody is grieving intensely, significantly, to the point of impairment and functioning in relationships, and if there are signs of depression, that's when you want to have a conversation with the person and see what kinds of supports they're already getting for themselves. Because if they're not in a support group or in therapy, that may be a time to have a conversation with them about that.
And that leads me on beautifully to my next question. What are the signs that we can, you know, use to recognize a major depressive like series?
So basically, when somebody's going through major depression, we're looking for at least 2 weeks or longer of extreme sadness and loss of pleasure in things that they usually used to enjoy doing. And this is usually accompanied by some feelings of guilt, feeling worthless. So they'll communicate like, you know, I'm stupid, I'm an idiot. There's some hopelessness in what they say, just negative thinking in terms of being able to see a solution. We see this in college students a lot, like, I'm never going to be able to graduate. I'm never going to succeed. I'm just a failure. You'll notice this person is agitated or restless, or maybe it seems like they're so exhausted, like they can't get enough sleep. There's a possible lethargy that you see about this person, where they're just maybe not even motivated to get up, to get out of bed, to go to work. They may be lashing out, and you don't know why they're lashing out at you. They may be withdrawing from their friends, from social situations. You may notice this person, you know, grabbing food a lot, like comfort eating, not really caring about their physical health, engaging in things that are impulsive, that are unsafe. That could be that. I always say, when you see that, you know, the risk factor is going up more and more. And then of course, somebody who is suicidal, that's a big red flag, that something might be going on. And sometimes people with depression, they always have the suicidal thoughts in the back of their minds. But the question is, does the person want to act on those thoughts? Or have they ever been fearful of their safety in terms of having those thoughts?
And would you say there's hope for someone who's had major depression? Is it curable?
So this is interesting because you will hear some people say that they have been able to cure their depression. And I think it's really important to be careful in saying the word cure, because depression is considered a chronic illness. And by chronic, I mean that, maybe at some point in your life, you can alleviate some of the symptoms through self-care, through therapy, through medications, to a point where maybe it was moderate to severe in terms of the intensity, but now it's mild. And maybe some days, you barely even notice it. And I think in that sense, depression can definitely be overcome in terms of the severity. It can definitely be managed. People can have healthy, successful lives, marriages, families with depression. The key is, how active, how proactive is this individual in getting treatment and in maintaining whatever it is that they've learned in terms of coping strategies to address it. So you have to be careful. Sometimes, if somebody makes a claim that they can cure your depression, I would be very hesitant to go to that person for help and support. Now, we have a lot of things, even in Islam, to help us manage depression. I mean, different verses of Quran, we know scripture reading, they've looked at the research, can help bring a sense of calm, a sense of healing, a sense of mindfulness and presence in terms of managing difficult emotions. But again, we've got to keep in mind that these conditions aren't 100% curable. And when we start to talk about it like it is, it can really be disheartening for people who think it is curable and then find that they really aren't able to completely get rid of it in their lives.
Okay, interesting. Thank you for that. And how can you recognize the difference between mild form of depression and severe depression?
Depression is on a continuum, right? So with milder levels of depression, you might see somebody who's having like negative thoughts, some changes in mood. They might feel like something isn't right. And at this level, sometimes there can be a misdiagnosis of what's actually going on. And maybe what they're dealing with is better fit for like grief or having adjustment issues or personality disorder or anxiety. But when you see more severe levels of depression, what you see is more of this lethargy, this lack of emotions, this numbness, kind of almost in a vegetative state. So, for instance, this can have a real impact on sleep, concentration, appetite. With somebody with severe depression, they might be just closing themselves off completely to the world, blackening their windows, having little to do with socialization whatsoever, not meeting with anybody, very very difficult sleep cycles where they may spend the whole entire day just in bed sleeping. Hygiene issues come up. Maybe this person won't bathe, they won't brush their teeth, they don't want anything to do with anybody else, and that's really indicative of something more severe. And then there are people that, they may have endured a major loss, maybe a horrific loss where their entire family was wiped out. I think about, people in Iraq, people in all over the world right now who are struggling with war. And even in this situation, you might ask, is this person struggling with severe depression? Well, what we can say is we're treating the symptoms in this situation, and we're looking at these symptoms, and we still need to give this person coping strategies, give them support to be able to get through the other side of that experience. And sometimes, you might not be able to pinpoint why somebody is experiencing severe depression. And that, if there's no trigger involved, that could mean there's a genetic component to it.
But my next question to you is about the causes of depression. What causes depression?
So there are a number of factors that can lead to depression. A lot of research shows that there's an imbalance in the brain chemicals, the neurotransmitters involved in sending different messages to the brain, such as, serotonin, dopamine. And then there's also life events that can trigger depression and lead to a depressed mood. So for instance, the birth of a baby can cause, some postpartum symptoms. War can contribute to PTSD. And then also some mood disorders tend to be genetic in nature and run in families. One of those I can think of specifically is bipolar disorder. So it can be one of these things. It could be a combination of all these things. And I think another thing we need to keep in mind is, sometimes people wonder, they're experiencing all these signs of depression, but they look back at their life and they've come out of a certain situation and noticed that these symptoms have dissipated, that they're no longer there anymore. And sometimes people are facing very situational specific struggles whereby a person can actually experience these symptoms of depression, but when they come out of that situation, it's not there anymore. And a situation I can think of like that would be somebody who's involved in a domestic violence situation, a spouse who is dealing with abuse, with verbal, physical, emotional abuse, may exhibit signs of depression, low self-esteem, worthlessness, wanting to check out of life. But then when they get the right help, they get themselves out of that situation, the symptoms aren't there anymore. So it's really important for us not just to look internally at what's happening, but also externally, what's happening in our environment that could be contributing to these sorts of experiences.
And can someone have a depressive episode without a trigger?
So yes, sometimes people can have depression without a direct cause. And like I said earlier, it could be triggered more by something biological, something chemical in response to how their brain is working. And this can be really frustrating. And I know I work with some clients who we try to find out what the triggers are in terms of some of the depression that they may be experiencing. And sometimes they're just like, I can't out what it is. Like I can't even put my finger on what could potentially be causing it. Everything is going so well in my life. I have a lot of support. I have good friends. And so this can happen without a cause. And this can be super frustrating for someone who's gone through this experience. But what happens is many researchers are talking now about how when a person experiences a depressive episode for the first time, they're actually more likely to have relapse later down the road. And that is because it's almost like that first depressive episode sets up a system whereby the neurotransmitters in the brain see it as an option to go back to that place that it went to before with the first episode. Kind of like when we talked about last week with panic attacks, how the incidence of relapse can increase over time just based on having that first experience, that first onset. So that's really important for us to keep in mind, because if having a first depressive episode can make us more susceptible to future episodes just by the fact that we've experienced this before, that means we have to work pretty hard to make sure that we are preventing it from happening in the first place at all. So because we don't want that switch to be turned on down the road again. Now, sometimes people can do something to prevent it, and sometimes there's not much somebody can do to prevent it. And we'll talk more about that in a little bit too.
So if someone suspects that they're going through depression, what's the first step that they should take?
The first step is you want to begin to write down the different moods, the different symptoms that you're experiencing. So you keep a mood record, so to speak. When you wake up that day, like the first thing when you wake up in the morning, what's your mood like? When do you begin to notice a shift? Writing down, at such and such time, I noticed this happening. If there was a trigger that prompted that, write it down. If there wasn't, just write no trigger. But doing this consistently for a week to see where your moods are at and what kinds of behaviors you're dealing with as a result of these moods. This record is important because it's one that you're going to take with you to either your primary care physician that you will talk to, or your mental health provider, or your psychiatrist. Now, I recommend that the first step should be to talk to your primary care physician. And the reason being is you want to make sure that there isn't a biological reason for the depression that you're experiencing right now. Sometimes if there's a deficiency in our metabolism and the nutrients that we're getting, that can cause some symptoms that mimic depression. So the first step is to get some blood work, talk to your primary care physician, and see what they have to say. When you come to this visit, you want to make sure that you write down your questions, what it is that you have that you want answers to about what you're experiencing. And depending on the severity of the depression that you're experiencing, maybe think about having somebody join you, because if you're in a state, for example, of depression where you feel like you're just out of touch with reality, it's probably going to be very difficult for you to internalize, to be able to take in the information. So think about bringing somebody with you who's going to support you, who's going to make sure they're hearing what's being said so that you're understanding correctly what's going on. And then after the visit, or during the visit, I should say, write down the things that are being said to you, like what diagnosis, what kinds of medications they might be suggesting. Just to put this out there, sometimes people get very fearful of medication, and you don't have to take anything that you really don't want to take, but you write them down, and at least gives you some time to explore the medication, to ask around, get maybe a second opinion. Maybe you want to also reach out to a mental health counselor to help you deal with the coping strategies, and you can discuss medication with that individual as well. But it's really important to continue to be proactive with this, not to let it go after the first depressive episode, because again, like, that is a red flag that if you've had it once, and as we said, depression tends to be chronic, it's likely you will have a relapse again. And you want to have that relapse on your terms and feel like you're in control, rather than the depression being in control of you.
And they say prevention is better than cure. Is there a way that we can control whether or not we go through a depressive phase or not? Is that something we can't control?
So we can definitely help prevent it, I would say.
Okay.
And I think the beauty of Islam is that it is preventative in its approach. Prevention is the best intervention in Islam. And so Islam already helps to prevent depression in a few ways that I can think of. One, by forbidding the use of substances such as alcohol and other drugs. And we know that when depression is combined with substance abuse, it's really a vicious cycle. Sometimes, alcoholism can actually bring on depression. If you think about it, alcohol is a depressant. People who struggle with depression, a lot of times the first thing they want to do is go drink. And they don't realize what they're actually doing is making themselves more and more depressed in the process. And so it's really important to avoid those substances. And so by avoiding the substances in Islam, you help to prevent depression from happening in the first place. And you help to prevent the maladaptive coping that would come about as a result of that. Suicide is another one I can think of, right? In Islam, suicide, taking one's own life, is forbidden. And I can't tell you how many times I've had clients say that I have suicidal thoughts every day. I just don't want to be here anymore. But I remember Allah, and I remember that this is something that isn't permissible. And because of that, I'm not going to act on these thoughts. So there are a lot of protective factors within Islam that help reduce the rates of depression as well as the rates of suicide. And when we look at different strategies for prevention, one of the biggest ones is exercise. Exercise is just like they've done studies to show that, like, it's almost like taking an antidepressant. essentially. When you are exercising, you're increasing dopamine, that blissful mood boosting hormone in your body, and you are able to just have a little more energy in your day, get past the lethargy. So they did a very famous study with over 33,000 adults. And these are people that had no mental health disorders at the beginning of the study. They had, good physical health, and then they followed them for 11 years. And when they looked at the research, they found that, essentially the regular exercise of at least 1 hour a week dramatically reduced any future depression from occurring. So we know that there's a lot of research, there's a lot of science out there that we can help to prevent depression. But sometimes, as I mentioned, there may be more that is required than just something like exercise. Sometimes we need cognitive behavioral therapy in addition to that. Sometimes people may need medication as well.
Are the signs of depression different in adults than in children? And how can we, recognize them in each?
Yeah, so with children and depression, it is very different. And it's more of a challenge, I would say, to be able to diagnose a mood disorder, depression in children. And that's because they just can't always express the way that they feel about certain situations. Whereas adults, obviously, they have more of an ability to communicate what's happening and what's going on. But I think with children, especially at the age of 5, 6, 7, like what you're looking at are changes in patterns of behavior, and how they might act and how they're eating and how they're playing. With teenagers, it's another challenge because they're not the most talkative group of people, but we know that, especially with the pandemic, that just rates of depression have been skyrocketing. So they're a really important group to target. We're basically looking for shifts in patterns, shifts in behavior, and it's really important to ask and check in with your kids and not just assume, all right, they're doing well in school, they're getting good grades, everything must be okay. It's not always the case. We do need to check in and say, hey, like, I noticed you've been acting a little bit differently lately. You've been more quiet to yourself. Is everything okay? What's going on at school? Sometimes there may be bullying happening, and we know that bullying can be a risk factor for the development of depression and anxiety and even suicide. So I would say that sometimes it can be hard as a parent to get information out of our kids, just because you're their parent and they may not want to open up to you, unfortunately. But I think at least trying to have that conversation, and if you feel like they can't be open with you, to find another trusted adult, mentor, mental health professional, especially if you are very concerned, who can talk to them and dig deep, see what might be going on underneath everything.
And a lot of people still find it difficult to believe that depression's a real thing. And a lot of people attribute it to having low faith. What would you say to those kind of people?
I would say it's time to educate yourself, because we have to realize that mental pathology exists. We have to realize that the brain is an organ just like any other organ in the body. And because of that, it's susceptible to pathology, it's susceptible to illness. And the science, the research indicates otherwise, that when you look at the brain under, PET scans, you see the difference in the activity level of somebody who's struggling with clinical depression versus somebody who isn't. Somebody who isn't, the areas of their brain just light up. You can see the neurotransmitters firing as they should. With somebody who has clinical depression, you don't see all that brain activity. And I think that's the hard thing, is we can't see inside people's brains when they're talking to us, right? And like, you can see a broken bone, you can see somebody losing their hair because they're struggling with cancer, but you can't really look inside somebody's head. And that's why it's so important to have conversations where you're not shaming the person because you think that their faith is low, but really asking what's going on and trying to get a better understanding. And I can tell you, having worked with Muslims and non-Muslims alike, you know, both groups struggle with depression. And I would say that, like so many of the Muslim clients I work with, they come to me because they have such a love of Allah. They have such a love for, Islam and wanting to better themselves as Muslims. And that's why they want to find a Muslim counselor to speak with. So they want to reconnect with their faith. They want to get to that point. Many of them are very devout, very religious people. The issue isn't faith. The issue is there's an illness. There may be external factors happening. There may be some unhelpful thinking habits that have been passed along through upbringing, through nature, nurture, and childhood development that are contributing. That's where counseling can help to get to the bottom of what's really contributing to the depression overall.
My next question to you is, are there any disorders that can be mistaken for severe depression?
There are, and that's why it's really important to start from the biological component of oneself and then work yourself up to other concerns that might be happening externally. So, as I mentioned earlier, one of the first steps in terms of managing this is to get some blood work, to reach out to your primary care physician, just to make sure everything is clear from a physical component. And then, sometimes that we might be going through cancer, we may be going through some significant illness that is happening that could be contributing to the depression, that could make it more of a situational issue. So that's really important in that time to get support, to be able to not just address the physical issues of what's happening, but also the mental health issues as well, because it's all interconnected. It truly is. Sometimes issues can be psychosomatic, right, as well, where we may be struggling with something mentally and it affects us physically, and we can be struggling with something physically that affects us mentally. So, we tend to just think about the brain when it comes to mental health, but really it's everything. It's the mind, it's the body, it's holistic in its approach. We also want to look at, are there any kinds of substances a person may be taking that are contributing to the depression that's going on? As we mentioned earlier, alcohol can be an issue because it is a depressant. Any kind of substance that is changing our moods in a dramatic way can set us up for long-term mental health issues. For example, even just schizophrenia can become a mental health issue, especially from between 18 to 24 with folks who are using marijuana. So we have to be very careful about, evaluating all the things that could be happening. And then also, is there trauma? That's the other thing I would want to know in talking to this person. Has there been a recent traumatic event that has occurred in which this person is now struggling? So we have to, again, look at everything holistically, not just treat the symptoms.
If you see someone who is struggling with severe depression, but they're not willing to seek help, what is it that you can say to them to try and encourage them to seek help?
Yeah, this is critical. I really think we can't underestimate the role that social supports play in terms of helping other people managing their anxiety, managing their depression, managing other mental health issues. Because here's the thing, a lot of times, the mental health provider isn't the first one that they're coming into contact with for their symptoms or what they're struggling with. Most of the time, it's going to be somebody else. It's going to be a friend. It's going to be a teacher. It's going to be a loved one who's going to tell them, I'm noticing there's some changes in you. Is everything okay? And sitting down and trying to have a conversation with them about what's going on. So I think if somebody isn't reaching out for help, what we need to realize is depression mutes an individual's ability to reach out. And that's where the struggle lies with depression, that sometimes we have to be the ones to reach out to this person. And the one thing I can't emphasize enough is listening, and doing some more listening with this person. Sometimes we just want to jump to conclusions with them and tell them, like, hey, are you seeing a mental health provider? I think you really should. And without trying to understand what's going on with them, you want to focus on connecting with somebody like this. They're already feeling so disconnected and so isolated, most likely. And if they haven't been getting help, there may be some stigma, some shame that they're going through. So it's really important to make time for somebody like this, and just to say, hey, can we sit down and talk sometime? Like, I just would love to catch up with you. And when you have that moment of sitting down and talking to them, asking the question, you know, can you help me understand a little bit what might be going on in your life? You know, you told me the other day you feel like you're struggling with depression. You know, what do you think is contributing to that? Understanding all of their reasons, understanding all of the factors, just taking the time to listen, to acknowledge, to validate, oh my God, I'm so sorry that you just had this experience where, you lost your brother in a car accident the other week. I'm so sorry that on top of that, you're dealing with financial struggles. You're dealing with other significant losses. Like, I can't imagine what it's like to be going through all of this at once. Like, and in this process, I think that person feels less alone because you took the time to care. You took the time to try to connect and understand. So what will happen is, at the end of this conversation, when you ask them, like, what resources have you explored or thought about to address your issues? And they say nobody. And then you talk to them about referrals or recommendations for who to reach out to. They're going to be so much more likely to hear what you have to say because you took the time to hear what they have to say. So we don't want to lecture people. We don't want to just walk up to them and say, like, you just need to have faith. You just need to hang on, and get into this competitive victimization of, oh, I went through hard times too when I was your age, and this is just a phase, and you're going to get out of it. That's not really helpful. What's helpful is just hearing the person out, validating what they're going through, and asking, okay, now that I've given you some resources, like, how can I help? What would help you through this difficult time right now?
Correct me if I'm wrong, but depression probably looks different from one person to another. So could there be people who are suffering from depression, but their loved ones or those around them don't actually know that?
That's an excellent question because, yes, I mean, obviously it looks different for every person. And I think there are many folks who have mild to moderate depression who are very high functioning. They go to work, they smile, they're very pleasant to deal with. But then when they come home and they're alone, they're sulking, they're, checking out, they're feeling numb again. And they go to work the next day and they do the same thing over and over. And they're able to function relatively well. And many people may not catch on to the fact that they're struggling with depression. However, for somebody who's severely depressed, I would say it's unmistakable if somebody's going through that, especially a loved one. I mean, you will notice that this person has something going on. They're going to show it. They're going to be slumped over. They're going to have this flat affect, this, just no facial expressions. They're going to be really negative. They're not going to want to leave the house. It would be very difficult, in other words, to be able to miss that. The only time I could think of somebody missing that would be if somebody didn't have family that checked up on them regularly, and it didn't really visit them often. They may not catch on to that. So other than that, I can't think of a situation where you would miss it.
We often hear the term self-care when it comes to mental well-being. How does self-care? How does that play a role in terms of clinical depression?
So self-care is absolutely critical. And by self-care, we mean that we're talking about behaviors that can alleviate symptoms of mental distress. So not just for depression, but any form of distress. So that could be like spending time with friends, going for a walk, eating a healthy meal. The problem is that with people who struggle with depression, they may not want to practice self-care at all. For somebody with this depression, the expectation to, like, do something that gives them a sense of joy, a sense of gratification, is very difficult for them. That may be nothing. Nothing may give them joy anymore. So to tell them to go spend time with their friends and socialize, well, they may not want anything to do with anybody. So that can be a real challenge, to just tell them to focus on their self-care, because they just don't care. How can you focus on your self-care when you don't care? This is the challenge. So these folks, they may want to stay in bed all day. They don't want to shower. They don't want to eat, go out anywhere. Of course, I'm talking about somebody with a little bit more severe depression as well. And obviously, it's going to differ from each person to the next. This person may even struggle to pray. They may struggle with negative impulses. They may want to do drugs or engage in certain activities that they know they shouldn't be doing. So the point is, what may seem like self-care to a depressed individual, isn't necessarily good for them, because for them, they may think, well, I should just do the thing that's going to gratify me in the moment, but that might not be the healthiest thing. But at the same time, they might look at this like list of like 50 things you should do for your self-care, and none of it appeals. So the caveat is, what do you do with this person? And I think that the key is, when you have depression, we need to realize it's difficult to be able to tell what self-care even is. And self-care may not always be something that's indulging. It might be something that we hate. Like, you might hate exercise, you know what I mean?
Yeah.
So, it's ironic, because sometimes it's the opposite of what you want to do. So it may not feel like self-care, but you need to do it. I can't emphasize this so as much. Like, if you have depression, you need to do self-care in order to get out of the rut, in order to get yourself out of the cycle. It's critical. So dragging yourself out of the bedroom to make a smoothie, it might not be what you want to do, but it's what you need to do. You need to focus on your nutrition. You need high folic acid. You need omega-3s in your diet. You need to really make sure you're eating nutrient-dense meals. Taking a walk, you might not feel like it, but you're going to feel a lot better after you do it. Forcing yourself to get out and go to a group of friends may not be what you want to do, but you're going to feel a lot better when you get in the habit of doing it. And you're going to withdraw less and less the more you put yourself in these situations. So my point is that sometimes, like, self-care isn't always laying in bed, just watching Netflix and doing what you want. It's doing the things that you know are going to help you get better. And that means creating discipline in your life and creating structure. And that is where the freedom is, not just having a free-for-all of, oh, I feel like doing this right now, let me just do that. So I think self-care it's a journey, it's a process, and the best thing you can do for yourself is to push yourself out of that comfort zone if you are in that situation.
And finally, what would you say to someone who might be struggling with sadness, grief, or a depressive order, but they feel like they've lost all motivation to pray or get closer to Allah subhanahu wa ta'ala?
I would say this is very typical. Know that you're not abnormal for feeling this. A lot of people who struggle with depression struggle with the motivation to pray, and they struggle in that relationship with Allah in general. I would say the main thing is, don't give up on your salat. We are approaching the month of Martyrdom, right? And you will see in the story of Karbala, prayer is everything. It is everything. Imam Hussain alayhi salam, he died to uphold the adhan. He and his companions, they actually, were praying on the fields of Karbala, and how dangerous was that situation at the time. And yet they took turns guarding one another just to protect the prayer, and some people died in that process. We look at Imam Zain al-Abidin, he was so sick at that time, and we hear the narrations of how he would, with every ounce of his being, try to get up, try to pray, and it was not easy. I mean, this was prayer at the risk of dying. So getting up with no motivation for life, to drag yourself to make wudu, to drag yourself to pray, I mean, it's hard. It's not easy, But this is self-care for someone who's struggling with depression. It won't feel like that in the moment or immediately, but the more you try to connect, inshallah, the more it will be your self-care process rather than prayer just being a burden or a chore that you have to do. You know, you may feel like you're too far from God to pray. You might feel like you're really ashamed or you're just too tired, right? And some of that comes from ourselves, some of that comes from shaitan as well. But you've got to tell yourself that, you know, maybe this isn't going to be my best prayer, my best wudu, but I'm going to do it and I'm going to make it a priority because I know that I'm going to feel better afterwards. I know that I'm honoring my commitment to Allah. And, you know, sometimes we get into this all or nothing thinking that if it's not my best prayer or I'm not doing it wholeheartedly, that I shouldn't do it at all. But really, you know, just try your best to do it, even if it's not your best. Sometimes doing it is the best that you can give in that moment. So hold on, you know, and inshallah, days will get better. There is a lot of hope. And you know, the depression will pass. You know, it's not a permanent thing. Feelings are not permanent. They come and they go. But, you know, as I always say, Allah is there forever and He's there with you and He sees your darkest struggles in these moments and knows how hard it can be for you to even get up to pray, and will definitely honor that and honor you for making the effort.
Thank you so much, Sister Anisa. Your words are very inspirational and very useful as well. Like, even for someone who isn't going through depression or, you know, knows anybody who's going through depression, just generally, some of the advice that you've provided us with is very, very useful, and inshallah I'll be taking it on board personally. Thank you to our dear viewers as well. Thank you, Sister Anisa, and thank you to our dear viewers for watching today. Inshallah you've benefited from the episode, and we'll see you again, inshallah, next week at the same time. Take care. Assalamu alaikum wa rahmatullahi wa barakatuh.